Hello and welcome to Effortless Mastery. Today we'll be learning the brachial plexus. So we'll be continuing what we started, but our focus today will really be on the function of the nerves. In our last video, you would have observed that we mentioned there are different branches from different cords. So I'm going to pick each of those branches, tell you about their function, what they supply, and then we move and then we're done for the day. Now in this video, for the brachial plexus, I'll start with the lateral cord. When we mentioned the lateral cord, we said the lateral cord had three branches, ML2. The first branch is musculocutaneous, which is something I will have to dwell on. But I do like how this nerve is named because it gives us an information to how it functions, Observe, it has the name musculo, it has the name cutaneous. Musculo means it will supply a muscle, which is motor function. Whenever you supply a muscle, that is motor function. But when you see the word cutaneous, cutaneous captures that it's supplying the skin. So this nerve will supply motor function to the muscle, but sensory function to skin. You should know that motor is effector, it's causing you to act, but sensory is when you're sending it back to the CNS. All right, so let's look at it very quickly. For musculocutaneous, what are the functions it has? Now, the muscle it will supply, musculocutaneous will supply the motor function. It supplies the muscles of the anterior arm. These muscles are three in number. We're going to do muscles in this our series. When I go to the muscle, I'll stay on each of them. But it will supply, for now, know that musculocutaneous supplies the muscles of specific anterior arm. So the muscles we have in the anterior arm is supplied by the musculocutaneous. Number two, we have, then okay, for the sensory supply, that was muscle supply or motor supply. For sensory supply, musculocutaneous supplies it gives off a branch we call lateral cutaneous nerve of forearm. Let's get the branch. So it will supply the lateral aspect. Or better still, I'll put it this way, that it supplies the skin of the lateral aspect of the anterior forearm. Let's understand that. So what does musculocutaneous, in terms of cutaneous supply, it is called lateral cutaneous nerve of forearm. Remember, this is your forearm. This is the anterior aspect. It will supply the lateral part. So you supply the lateral aspect of the anterior forearm. But remember, we are talking about the skin. That's number one. The L's. We had an L called lateral pectoral nerve. What does the lateral pectoral nerve supply? The lateral pectoral nerve will supply the pectoralis major. Lateral pectoral nerve supplies pectoralis major. Lateral pectoral nerve will supply pectoralis major. Pectoralis major is a muscle found in the pectoral region, usually this region here. So pectoralis major. So lateral pectoral nerve will supply it. Now beyond that, we have, so this covers my lateral cord. Next up will be my medial cord. For my medial cord, the branches we had, remember, was So U is ulnar nerve. What does ulnar nerve supply? Ulnar nerve will supply a particular muscle in the anterior forearm called flexor carpi ulnaris. Muscle is something I'm going to teach you carefully in one of our videos under this playlist. Flexor, flexion. Carpi is wrist, carpus. Then ulnaris means it is at the ulnar border, which is the medial border. So flexor carpi ulnaris is supplied by ulnar nerve. So that is in the anterior forearm. Also, it supplies the medial half of a particular nerve, of a particular muscle called flexor digitorum profundus. So there's a muscle we call flexor digitorum profundus. I don't like words like this that sound so big. Flexor means you are causing flexion. Digitorium means where the flexion is affecting is the digits. These are the digits. So it will be on the digits. So I'm causing the digits to flex. And which particular When you hear the word profundus, profundus or profundi talks about deep. So this is the deep flexor of the digits. So who supplies the medial half of the deep flexor of the digits? Ulnar nerve. So those are the two muscle supply, that is motor supply it has. It will supply the flexor carpi ulnaris, supply the median half of flexor digitorum profundus. That in the anterior forearm. When we get to the hand, it is the main supply to the hand. It is the main supply to the hand. So within the hand, what we get to observe is who does the ulnar nerve supply in the hand. It will supply hypothenar muscles. In the course of our lecture, I'm going to teach you about each of these muscles because it will help this make more sense to you. So ulnar nerve supplies the hypothenar muscles, which is these muscles here. Remember, this is the ulnar part. So the ulnar nerve will come down this way, supplies flexor carpi ulnaris, supplies medial half of flexor digitorum profundus, supplies hypothenar muscles. We have some muscles here we call interosseids. So it will supply both the palmar and dorsal interosseids. All of these are just muscles, they are muscles within the hand. And then lastly, it will supply the third and fourth lumbrical. Third and fourth lumbricals. All right, so these are muscles all supplied by ulnar nerve. So ulnar nerve is a very wonderful guy. So you observe that, what did I say supplies the anterior muscle of the anterior arm? Anterior arm was musculocutaneous. But when you get to forearm, only little of it is supplied by ulnar, which is for FCU and FDP, medial half of FDP. But when you come to the hand, it is the main person to supply hypothenar, supply the interosseids, both palmar and dorsal. Then it supplies some muscles we call lumbricals, but not all of them, third and fourth lumbricals. Now, it also have a sensory innervation, and its sensory innervation is in the hand. It will supply the medial 1.5 of the hand, both in front and behind. In front, remember, this is the palm, this is the dorsum. So in terms of sensory supply, still on ulnar nerve, sensory supply of ulnar nerve. Sensory supply of ulnar nerve will now be the medial 1.5. So medial 1.5. So if you observe, you have 5 fingers, 1, 2, 3. You divide it here. So this one and half of this. The medial 1.5 of the hand. So it will supply the skin of medial 1.5. So please remember that it supplies the skin. So that's why it is called sensory function. So for muscles, these are the muscle supply for ulnar nerve. Now we have M's, the M's, medial pectoral nerve. Medial pectoral nerve supplies both pectoralis major and pectoralis minor. So this is the trick, that whenever you hear pectoralis major, who supplies him? Both lateral and medial pectoral nerve. But when you hear about pectoralis minor, it is supplied only by medial pectoral nerve. Now beyond that, let's keep looking up, keep following me. Now we have M. Remember, M here was medial root of median nerve. The L here, one of the L's here were lateral root of median nerve. So let's talk about the median nerve. Who does the median nerve supply? Who does the median nerve supply? The median nerve is going to be supplying the muscles of the anterior forearm. So it will supply all the muscles of the anterior forearm except flexor carpi ulnaris and medial half of flexor digitorum profundus. Remember what we said earlier, that ulnar nerve supplies flexor carpi ulnaris. Ulnar nerve supplies medial half of flexor digitorum profundus. So every other thing here in the anterior forearm is supplied by median nerve. Apart from those two, all others are supplied by median nerve. When you come to the hand, what the median nerve will supply right here in the hand is that the median nerve will supply the thenar muscles. Thenar muscles. Please remember, these guys supplied hypothenar. So this is called thenar eminence. This is called hypothenar. So median supplies here, ulnar supplies here. Then beyond that, it will also supply the first and second lumbricals. So that is that for that. Then in terms of its supply to the skin, which is the cutaneous innervation, what it will supply will be, remember we said we divided the hand into 1.5 and 3.5. So the lateral 3.5 of the hand will be its sensory. So its sensory supply will be the lateral 3.5 of the hand. But it will be, remember, it's still what? Skin. So if you observe, whenever I'm talking about, if I'm coming to the palm, please, lateral 3 of the hand, I think I should use the beta word of the palm. Because this is what happens in terms of sensory supply, which will be my next topic with you, cutaneous innervation. My median nerve supplies 3.5. Then this other 1.5 is supplied by ulnar nerve. Remember in the forearm, for forearm, who was the main supply to the anterior forearm? It was median. Now, only 2 muscles were supplied by ulnar. But when I get to hand, median will only supply thenar and the first and second lumbricals, whereas ulnar will supply hypothenar, the third and fourth lumbricals, and it will still supply the palmar and dorsal interosseous. All right, so that is that. Now, we had medial pectoral nerve. I mentioned some other nerves under medial called medial cutaneous nerve of arm. Of course, that will supply from the name medial cutaneous to supply the skin, the medial aspect. So when you go to skin of arm, the medial part. Now we also had medial cutaneous nerve of forearm to supply the skin, but the medial part. So that is that for that. Now we go forward. We now go to our posterior cord. If you remember my acronym for posterior cord, it was ultra. Ultra. Now I start U. U was upper subscapular. Upper subscapular and lower subscapular together supply a muscle we call subscapularis, one of the rotator cuff muscle. So upper subscapular and lower subscapular will supply subscapularis. Now, lower subscapular alone supplies teres minor. So together they supply subscapularis. Then teres minor supplied only by lower subscapular. Then thoracodorsal supplies a muscle we call latissimus dorsi. Latissimus dorsi is this muscle that helps us with climbing. When you are climbing, it's okay. So you feel it here, latissimus dorsi. So it's supplied by thoracodorsal nerve. Then the last 2 nerves, radial and axillary. That's where I want to stay on. For my axillary nerve, the muscle it will supply, axillary nerve. The muscle the axillary nerve will supply is deltoid and teres minor. Please forgive me. Earlier, I said lower subscapular. Please, lower subscapular supplies teres major. It is axillary nerve that supplies teres minor. So deltoid and teres minor. So upper and lower subscapular supply who? Subscapularis. Lower subscapular alone will supply who? Teres major. Now, axillary supplies deltoid and T minor. Remember that these people I've mentioned are actually muscles. It also supplies skin. The skin of this superior lateral arm. The superior lateral, so superior lateral arm. That is what he will supply. The skin of superior lateral arm will still be him. Now that covers axillary. Lastly, radial nerve. Radial nerve is a very wonderful guy because he's the largest branch. He's the largest branch of the entire brachial plexus. The entire brachial plexus. What does it supply? It supplies the muscles of the posterior arm, muscle of the posterior forearm. It will in terms of muscle, it supplies muscle of posterior arm, muscles of posterior forearm, and then it will now, that will be its muscle supply. For skin, it will supply the skin. It also supplies skin of posterior arm and forearm. It will supply skin of posterior arm and forearm, and then also it will supply the skin of the 3.5 dorsum of hand. So when you get to the hand, this is the pattern for the hand. 3.5 in front, supplied by median, skin. 3.5 median, 3.5 behind, radial. 1.5 in front, ulnar, 1.5 behind, ulnar. So ulnar is constant, both in front and behind, for 1.5. Median is 3.5 in front, radial is 3.5 behind. What will supply skin, the posterior, entirely, is strictly for arm and forearm, is radial nerve. The other branches I mentioned, like suprascapular nerve will supply supraspinatus and infraspinatus, which are rotator cuff muscles. Which other one do we mention? Dorsal nerve to subclavius to supply subclavius. Dorsal scapular nerve will supply levator scapulae, which is a muscle that elevates the scapula, and then it will also supply rhomboids, both major and minor. Then long thoracic nerve supplies a wonderful boy called serratus anterior. And whenever there is a damage, please you must note this. A damage to long thoracic nerve, a damage to long thoracic nerve will lead to something we call winged scapula. Winged, like winged scapula. All right, so that is that for the functions. So we have mentioned different nerves and their function. Just to summarize the motor function, I said that the arm, anterior arm, is supplied by the muscles. Anterior arm is supplied by musculocutaneous. But when you go to posterior arm, it is now radial nerve, muscles. When you come to the muscles of the anterior forearm, majorly median, except for ACU, flexor carpi ulnaris, and medial half of flexor deuterium profundus, which is supplied by who? Ulna. So, but most of the anterior forearm is median. Posterior forearm is still radial nerve. When you come to the hand, we have thenar muscles, median, hypothenar, ulnar, first and second lumbricals, median, third and fourth lumbricals, ulnar. Then all the interosseids, both palmar and dorsal, are ulnar. Then that will capture the muscles here. Then every other muscle, for my seat muscle, suprascapularis is supplied both by upper and lower subscapular. The second one, supraspinatus. Supraspinatus is supplied by suprascapular nerve. Infrascapular. Teres minor, supplied by axillary nerve. Axillary nerve will supply deltoid, supply teres minor. So that covers the functions. Now, very quickly, let me give you a very quick trick to know the damage. What happens if any of this nerve is damaged? I just want to give you the common ones we have. A particular acronym called Dr. Kuma. Dr. Kuma. Doctor D, there is. The R is the nerve, radial nerve. When it is damaged, it will cause wrist drop. So the D there stands for drop. So because remember, the radial nerve should have helped with extension. So when it is not there, the person's hand will be this way. That's wrist drop. And that's damage to radial nerve. So D is drop, wrist drop, damage to radial nerve. C and U. U is ulnar nerve. If it is damaged, we have a condition called claw hand. Claw. C-L-A-W hand. So claw hand. That is due to damage of ulnar nerve. Lastly, if medial nerve is damaged, A will happen, which is Apes hand. Though damage of medial nerve can cause two conditions, Apes hand and another one we call hand of benediction. Apes hand and hand of benediction. So that is what the acronym stands for. So this brings us to the end of brachial plexus, which in our second video, which is our video today, the main thing we stayed on was the function of each of the individual nerves. Please, if you have a question concerning this, please do well to type it out in the comment section, as I will answer and respond to all of the questions concerning the function of each of these individual branches of the brachial plexus. Thank you so much for joining us. Until next time.